Good morning. My name is Dr. Janine Adjo, and I am the chair of the Department of Pediatrics here at SBH Health System. Joining me today are Bronx Borough President Vanessa Gibson.
Thank you.
And also Dr. Vanessa Lewis, who is a board-certified OBGYN here at SBH. Thank you for joining us. Happy Black History Month to you both. Now, alarmingly, in the United States, maternal mortality rates continue to climb. And what fascinates me is that within the United States, we are one of the wealthiest nations in the world. But within the United States, out of all industrialized countries, we have the highest rate of maternal mortality. And so within that population, Black women are 3 times more likely to die because of pregnancy-related causes. And so with that in mind, Dr. Lewis, can you please define for us maternal health and maternal health care?
So maternal health care refers to the care that is provided during pregnancy, childbirth, and in the postnatal period, or the postpartum period.
So now, knowing that maternal health care deals with pregnancy-related issues, prepartum, intrapartum, and postpartum, Dr. Lewis, what are some of the issues affecting Black maternal health care that are leading to such poor outcomes and this increase in maternal mortality?
One main thing that we have to acknowledge is that the field of obstetrics and gynecology was essentially studied through Black women. And we should acknowledge that and understand that that also contributes to a level of mistrust. It has impacted our patients in the manner that they receive care as far as racial bias. We have these higher rates because our patients are living in communities of lower socioeconomic statuses, and their diets are not up to where they should be. So we have higher rates of diabetes, high blood pressure, which are pre-existing factors when we're thinking about pregnancy in the first place.
And Borough President Gibson, highlighting your promotion of accessible and equitable health care in the Bronx, what can you and your office do to help, or what are you doing to help with these astronomical numbers?
Right. Thank you both. I really appreciate the opportunity to be here, and happy Black History Month. I think this month reminds us of the incredible contributions of Black Americans here in the Bronx and beyond, but it's also a call to action and attention of why within the Black community, so many of our Black women are dying during childbirth, right? When childbirth should be the most blessing that you ever have to become a mother, to bring life into the world, but yet we see so many of our sisters that are faced with a lot of these health disparities that we know have existed for quite some time that was exacerbated during COVID-19. So our office is very intentional, very purposeful, because as a Black woman myself, I take this very personal. When I see women that look like me, they go into hospitals and medical settings, and they're often discriminated against just because of the level of insurance, because of the documentation they may or may not have. They may or may not speak English, right, as a primary language. And there are so many barriers that Black women have historically faced. I think these numbers have been rising for a reason, and we have to look within the system to figure out why Black women are not getting equitable health care treatment. So our office, when I got elected 2 years ago, we had a Bronx Maternal Health Consortium that we have been building out from the prior administration. And it is a combination of birth workers, doulas, and midwives, OBs, GYNs. We work with all of our hospital partners, both public and private. We work with our FQHCs. And we've been meeting quarterly to talk about policies, what bills are being put forth at the federal, state, and local level. How can we support more efforts to make sure that healthcare is accessible? How can we deal with some of the challenges that so many Black women have been facing when it comes to prenatal care and postnatal care? How can we make sure that we reduce those barriers that many Black women historically have faced? So we've been coming up with a series of recommendations, and we're gearing up for the release of a birthing report, which I'm very excited about. And the Bronx needs a birthing center. We've had some over the years, Morris Heights Health Center and others I can think of, but right now we don't have our own birthing center. And that to me is an injustice. And unfortunately, we've had horrible cases in this city where women have actually died. and we've seen litigation, we've seen lawsuits, but I also think it's a reason to find common ground and to put everyone in spaces together and talk about critical policy ideas. Budget, we need money, because in order to get resources and programs, we need money. And so we're looking at this from a very holistic perspective, and rolling out our birthing report is really going to be the center of our healthcare initiatives.
I agree. Data is power. With data, we're able to actually make changes and ask for the money that we need, the space that we need, and the policies that we need. So I agree with you. Now, Dr. Lewis, hearing Ms. Gibson speak and understanding that the loss of life impacts life potential, that the loss of these Black women's lives impacts families, communities. It has far-reaching implications on educational spaces, scientific spaces, economic spaces, political spaces. What can we do as a medical community in the borough, in the city, in the state, in the nation to address this crisis?
First and foremost, we need to provide culturally diverse care teams, culturally competent care teams. And this is not just racial background, it's also work titles as well. We need to have, our midwives, our doulas, our physicians, all included in the process, because the more that we have that collaborative work happening with our teams, the better outcomes research has shown. We also know that racial concordance has halved neonatal deaths and maternal deaths. So it's important to make sure that our care teams fully represent the patients that we are representing, that we're taking care of. Black women are the highest in the workforce, highest percentages, almost 62%. However, on the other side, they have the highest unemployment rate as well.
Yeah, I mean, I do believe that advocacy for our patients is probably the number one thing that we can do in terms of economic and political policies. But you touched on something. You talked about cultural competency training. And I think that's important because bias can be very rampant. No matter what industry you're in, it could be very rampant. And what we found in studies is that, a lot of people will point to its socioeconomic status as the reason for the Black maternal mortality crisis. But what we found in multiple studies, that it doesn't matter if you make three figures or 8 figures, Black women still have a higher likelihood of dying during childbirth or around childbirth. Yeah. So I think bias training would be really important. Figuring out, recognizing that you have the biases, and then figuring out how to relate to your patient in spite of your biases. And that in-person way of speaking is a definite strategy for some of our patients.
Absolutely. I think communication is paramount. We need to be speaking to our patients clear, concise, answering questions that they have. We need to be speaking to them on levels that they can understand.
Thank you for talking about all the initiatives that you both have going on. Now, specifically at SBH, what kind of initiatives are we using to address Black maternal mortality rates?
Yes. So I can say from experience, our team is a very culturally diverse team as far as racial and our job titles. We have midwives on board, we have physicians, we have pediatricians, neonatologists, MFMs, who all work and are available to provide input on our patient care. We have a partnership with Ask a Doula services so that the patients have access to a doula right there on their phones if they need to ask a question. And then furthermore, if they need to be referred to a doctor, we have that available to them. We have monthly baby showers here at the Wellness Center.
And I would say also at SBH, every baby that's born here has to be seen by their pediatrician within the first week of life. And the pediatricians also assist you with maternal health care because we assess for postpartum depression. We assess for social determinants of health to make sure we can add any resources that a mom or a family might need. So our pediatricians actually join hand in hand with our OBGYNs here to support the maternal health of our mothers here. So we are definitely trying to attack this crisis. Yeah, and we're going to talk about some of the services we offer and where you can find them in a moment. But Ms. Gibson, I am going to give you the last word on this topic. And then after you have the last word, I would like you to tell our community members where they can find comprehensive quality care for women and children here at St. Barnabas. So, Ms. Gibson.
I want to see the city and state do more PSAs. Personally, as we ride the subways, the buses, we're always traveling. You should be able to see campaigns about organizations, about what SBH is doing, about new events, signing up for things, using different modes of communication, BronxNet, News 12, so many different ways that we get our information, what is out there. Because sometimes mothers feel alone and they feel like no one cares because they just don't know. And like you said, you have to meet clients where they are, and you have to really allow them to understand what you're talking about in a way that they can understand. I think about some of our African women that are sometimes that come from the Muslim community, and they have different cultures that we have to acknowledge and respect and make sure that we're addressing it in a very culturally sensitive way. We have made progress, so we don't want to sit here and make it seem as if it's so gloomy. We have made significant progress when I think about how far we have come. We also have, in addition to our consortium, we have an organization called the Bronx Health Link, and they're in our office at Borough Hall, and they're trying to become a birth justice hub where you have different organizations that are working together, and they're able to access funding, right? Because we know that that's the pathway to really addressing these statistics. And what I often say, turning statistics into success stories. We want to keep women alive and healthy so that they can deliver safe babies and that their babies can grow up. That is our goal. We don't want to see any more fatalities in this industry. It's happening far too often.
And with that, Dr. Lewis, where can we find quality care here at SBH?
So we also provide care at Arthur Avenue Women's Health and Arthur Avenue Pediatrics, as well as Bronx Park Women's Health and Bronx Park Pediatrics. We have a GYN oncology service. We have a specialized clinic there for our cervical cancer screenings, management. We have our prenatal care services that are offered there. We do have at the Bronx Park site our MFM and our imaging center. Am I missing something?
Yes, the Wellness Center.
Wellness-
We're
okay.
sitting in this beautiful
We are.
space. It's the SBH Women and Children's Wellness Center. It's a beautiful center where we actually connect women and children. And as Dr. Lewis was saying, you can have your prenatal care and your postnatal care here while taking care of your children. We know that women are the primary consumers of health care. So with that in mind, we wanted to create a space where they could bring their children and also have quality care here themselves. So here at the Wellness Center, we also combine pediatric services as well as OBGYN services. Thank you for joining us this morning. This was a wonderful conversation.
Absolutely.
We are SBH Health System. We're a community hospital, but we have a global vision. So thank you for joining us.
Thank you.